Now at 5:30, Women's Health Headlines, where we focus on health stories specifically impacting women. And it is Breast Cancer Awareness Month. We're finding out how breast screenings have become more accessible in Connecticut. And joining us now to talk more about it, Dr. Diana James, the head of imaging with Jefferson Radiology. As always, Dr. James, thank you so much for being with us.
Thank you, Erin. Thanks for having me.
Of course. So obviously over the last few decades, a lot has changed, especially in terms of accessibility. How much easier is it to get a mammogram today than it was years ago?
It's a lot easier. Before, you actually had to go into the hospital, which you still can do, but now we have lots of outpatient imaging centers scattered all throughout the state. So there's really no excuse. There's, I bet, a location near you to get that mammogram.
And in terms of the time it takes when people actually go, they may be reticent to go, saying, is this going to take all day? What's the time commitment? How would you kind of quell their fears and quell their anxiety about what to expect?
Absolutely. So I'm not going to say it's a super fun test. To get good pictures, we have to use a little bit of pressure, with that x-ray machine, but it's a 5-minute exam. So it's super fast. You can do almost anything for 5 minutes, right? So grab a friend, grab a sister, mom, head on over.
And it has to be easier than giving birth, I'd imagine. So, so there's always that, right? For those concerned with money reasons, we talked about accessibility and locations and the time commitment. In terms of finances, does insurance here in Connecticut cover these mammograms?
I am so proud to say, yes, it does. It took us such a long time to get that conquered. So the bill for coverage of screening tomosynthesis specifically, so that 3D mammogram that we've been talking about all month, that got covered in 2019. And then actually last year, literally during the pandemic, the state approved coverage for screening breast ultrasound. So women that have dense breast tissue, that is a covered screening exam for them as well. So great progress in Connecticut on both of those fronts.
I was just going to say, that is wonderful. Why do you think insurance has decided to pay for it? And is there also, in terms of the age, does it start when you're 40 or 50? Does age matter with insurance?
So to your first question, insurance decided to cover it because it just makes sense, right? We all know, we've heard the phrase early detection saves lives. So definitely from a patient perspective, that's absolutely true. And what's also true is that it's cheaper for the insurance company, right? So if I find your cancer and you don't need chemotherapy, we all know how expensive chemotherapy is. That's a win-win for all the patients in that insurance plan. So that's why it made sense to cover those screening tests, okay? As far as when you should start, a lot of physicians, you should talk to your doctor, talk to your primary care, talk to your OBGYN. Most people feel that you should start at age 40. It's still a little controversial. We're kind of going between 40, 45, but it's definitely somewhere in that zone. And if you have any concerns about family history, maybe you think you might be a high risk patient, talk to your doctor because maybe you should get some testing or, see a subspecialist.
And will insurance cover you at the age of 40?
Yes. Mm-hmm.
All right. So that is good to know. How often after someone goes for their first mammogram do you recommend women coming? Is it every year? Is it every other year? Every 5 years?
So for the premenopausal women, so basically the women that are before 50, yes, you really should go every year because we know that group of women tends to get the more aggressive form of breast cancer. So you're really trying to catch that cancer before it's spread anywhere. We know from biology that breast cancers in women that are postmenopausal, typically over 50, 55, they tend to be less aggressive. So there is some data to suggest you could skip a year. And again, it really depends on you, your doctor, what your own personal risk history is. But on average, for the average person, you could probably go to every 2 years after menopause.
Well, as always, you are an incredible wealth of knowledge. I hope all the women watching tonight schedule their mammograms. If you have not already done so, it is so important. Dr. James with Jefferson Radiology, thank you so much.
Thanks again, Erin. Appreciate it.